Good afternoon, everyone, and welcome to the Dräger webinar, Redefining Developmental Care and Thermoregulation with Babyleo TN500. I would like to welcome you all to our webinar. And before we start, I would like to go through some of the organizational topics that are relevant to our webinar today. So before we start, I would like to ask you to use your raise your hand symbol on the right side of your webinar panel to show, to let us know that you can hear us and you can see the slides well. So you can find your raise your hand button on the GoToWebinar dashboard on the right. Excellent. So some of you have raised your hands. Excellent. Thank you very much. So that means you can hear and can see as well. So in today's webinar, we're going to spend some time on covering the theory and practice. And if you have any questions, please use the question bar or question box to type in your questions. We will go through the questions at the end of the webinar. So we will try to address all of them, and depending on the time, if we cannot answer any of your questions, we will reach out to you directly by email, but hopefully we will be able to answer all of your questions. So today I'm happy to introduce to you our two speakers, Ms. Inken Schröter and Mr. Oliver Waltz. Inken is a product manager from our Dräger headquarters that is based in Lübeck in Germany. Inken has been working as a product manager in neonatal care department since 2007 in Lübeck in Germany. And she's one of the leading instructors at Dräger for neonatal care topics, providing clinical and technical trainings on various subjects such as jaundice management, thermoregulation, and developmental care. While Mr. Oliver Waltz, he's our business manager for neonatal care, and he's been working for Dräger since 2005. In the last 15 years, Oliver held various roles, including global service management, strategy implementation, and customer value creation. So hopefully today, the two of our speakers will share how Dräger is committed to improving outcome in the neonatal care by optimizing thermoregulation in the NICU and by also offering neuroprotective environment and developmental care strategies in the NICU. So in order to not overload any of the bandwidth or the internet, I'm going to disable the video for the time being, and then we will be back here for the questions and answers. So I hope you will enjoy our webinar, and I would like to welcome Inken and Oliver.
Thank you very much, Margarita. And yeah, also hello for everyone and welcome to this webinar. I'm very excited that we have now this hour to talk about developmental care, thermoregulation, and how we can support you with that. So what can you expect out of this webinar? So we would like to focus on two topics, as Margarita explained. The first one is thermoregulation, and the second one is the focus on developmental care and family integrated care. You will learn about the clinical background, the latest studies, and we will have a look at our IncuWarmer Babyleo TN500 and how this device can support you with this. So this is not intended to be a detailed product demonstration, but rather an overview of the topics, the application, the studies, and how this device can support you with that. So this is our agenda for today. So first we will have a quick look at Dräger in the NICU, followed by the topics of thermoregulation. Then we dive into developmental and family integrated care. And last but not least, we have time for your questions and answers. So let's get started.
Yes, and this is my part here. Hello, everybody. This is Oliver Walz speaking, and thank you for the introduction, Margarita. Apparently, all speakers dialed in from home today. Yeah, we have special times, and we all have to adapt to this. So before we go into the specific topics, I want to share with you some, let's say, overall more strategy related topics. Where do we stand for at Dräger when it comes to neonatal care? What do we offer for the NICU? And saying this, I would like to start with, and maybe you have heard about this, a rather hospital-wide value proposition. Where does Dräger wants to stand for when we come to hospital applications in total? Yeah, and this is our mission. What you see here, we want to be your specialist in acute care. We want to be your partner. And this is how we communicate via different channels, via web and social media and other things. And you might have had contact to this. So our all guideline is we want to improve acute care, and along this guideline we provide all our applications and our activities. So let's see how we do this in neonatal care. Neonatal care is one of the hospital portions, so to say, next to the much bigger ones. Honestly, the much bigger ones, anesthesia and ventilation. So our neonatal care solutions consist of thermoregulation devices, open care, closed care, transport devices, jaundice management devices like the jaundice meter and the phototherapy solutions, and last but not least also transport devices to transport babies within or between hospitals. First of all, I want to start with a little history here, and you might have seen these persons before. We share this when we explain the company. So we have got generations of innovators in the Dräger family, as you see here. This all goes back to 1889. So the person on the very left, Johann Heinrich Dräger, he started with the company Dräger in 1889, and here you see a row of his successors. And at the moment, Stefan Dräger is our chief executing officer. This is in the 5th generation, and still this is a family-owned company. And this is what is part of our so-called DNA. It's very important for all of us that we are still owned by the family. I talked about 1889, so yeah, that's the starting point of Dräger. It's not the starting point of neonatal care. But 1889, if you want to remember this, it's the same year when the Eiffel Tower was built in Paris for the World Exhibition. In 1952, we started at Dräger to provide and present the first neonatal care device, a first incubator. You see this here on the left side. And step by step by step, we increased our portfolio. And the latest big launch of devices was the Babyleo, which is also in the focus later. It's a hybrid device. We do not like the word hybrid. This is why we call it an IncuWarmer. It's a mix between closed care incubator and open warmer. And yeah, we show you the device a little bit later in our dedicated sessions. Stefan Dräger, he is, as I explained, the current CEO, and also his commitment is, and this is a citation here from him directly that shows that he's also very much committed into neonatal care. He's saying every newborn deserves a good start in life and a place to thrive. And we like this support from him directly. Also for this rather small business area of neonatal care. So what is our mission in neonatal care? And this is what we put down here. We want to contribute to reduce morbidity and mortality for newborns. This is in the focus of all our activities. Yeah. And we do this via, we call it strategy pillars. You see it here in each corner. We do this via the provision of protective therapies. We want to provide solutions to create on your side care-centered workplaces. A big trend at the moment is to connect devices with each other. So we call this connected technologies. So the interoperability of devices becomes more and more important. And last but not least, all of this is, so to say, embedded into our service portfolio, where we want to create a kind of peace of mind on your side if you decide to go for a service contract. Today, we look into two specific topics, as Inken explained already in the very beginning. Today, we look into our very important topic of thermoregulation. Yeah. And our target here is, as you see it on the slide, sorry, we want to maintain the temperature at all times for the babies. Yeah, we want to avoid cold stress and heat stress. And how do we do this? We do this with a variety of different product solutions. Yeah, so we touch different levels, so to say, in the NICU with open care devices, with closed care devices, or with the IncuWarmer, the Babyleo. Our engineers do the best to create the best microclimate in these devices, yeah, which is a mix of not only heat, but also of humidity and maybe also oxygen. And last but not least, we also monitor what we do there. We call it thermomonitoring, so we know exactly in which state the baby is by looking very carefully into these monitoring of the core or the peripheral temperature of a baby. The second topic which we want to talk about today is developmental care. So what is our mission with this regard? We want to create nurturing environments. Yeah. And how do we do this? We offer in the best possible way, and I have to say, we are only a supplier of devices here. It's up to you to embed this into an overall philosophy. But as a supplier of devices, we support you to offer these nurturing environments, for instance, with the neuroprotective care philosophy, reducing noise levels of the devices. We support with our technology the topic of kangaroo care, and this goes into skin-to-skin care and the bonding with parents. And last but not least, and maybe not so much for thermoregulation devices, but if you consider ventilation devices or also our jaundice meters, we look into the topic of non-invasive interventions. Yeah, we want to reduce stress for the babies and do as much as possible non-invasive. So let's see how the Babyleo in specific support these two key topics which we want to discuss today. And I hand over to Inken now.
Perfect, thank you. Yeah, let's get started with the first topic of thermoregulation. So why does thermoregulation actually matter? So one could say it's a basic practice, but if you look at premature babies, it can be very crucial for them, especially because preemies cannot regulate their own body temperature. So that's why normal or simple nursing procedures can have a severe impact on the microclimate around the baby, and that by that can cause thermal stress for the baby, meaning, for example, hypothermia. And actually that can cause changes in the metabolism. You can have increased O2 intake. You see an impact on the respiratory rate. And this is actually why we have to look at thermoregulation for premature babies specifically. But what is the opportunity here to improve the outcome? So we know, for example, that effective thermoregulation is crucial, as for every degree below 36 degrees, the mortality increases by 28%. So that means if we can keep the baby stable, it can have a positive impact on the outcome of the baby. But how can we achieve this? So that's why I would like to take the time to look at the theory of the thermoneutral zone and its impact on the O2 uptake and the energy transformation. So for an adult, it's rather easy. Adults can regulate their own body temperature and can also compensate for heat loss or gains via, for example, evaporation. So that means sweating, or vasodilation or vasoconstrictions. So they can keep their body in the thermoneutral range rather easily. For term babies, it's also possible. So they have this brown adipose tissue that they can use to generate some heat, but of course they need more assistance to stay in the thermoneutral zone. But the picture is much more different for premature babies. They do not have this brown adipose tissue that they can use to generate heat. So they are not really able to regulate their own body temperature. So that means their thermoneutral range is rather narrow. And that means that we have to support them so that they don't have to use their energy to generate heat, because they need all their energy to grow. So to conclude, you can say that a proper thermal environment occurs if the infant is neither gaining or losing heat, so that the patient is in the thermoneutral zone, that the energy transformation is at a minimum level, and that all calories are used to grow and not for the heat production. This can, of course, vary depending on the gestational age of the baby, the current age, and the weight. So if you have a 24-weeker or a 36-weeker, that's of course a huge difference. It also depends on the skin development and the fluid loss potential. It can depend on the clothing and also on the medical conditions that the baby has. However, our thermoregulation devices can and should support the creation of a thermoneutral environment. So this can be achieved by using, for example, open warmers, the classic incubators, or in our case, the IncuWarmer, which is a combination of the two. If we look at the patient pathway, we can see different requirements regarding the management of a thermoneutral environment. So in labor and delivery, you definitely want to prevent hypothermia at the beginning. The baby is taken care of in open care. There's always the risk, depending on the environmental factors, that the baby is getting too cold. When the premature baby is transported from labor and delivery to NICU, you definitely want to keep the temperature stable. And at the NICU, you want to create an environment where the baby can grow. To better understand how warming therapy devices can address the different situation, for example, at labor and delivery or at the NICU, let's have a quick look at the 4 ways of heat transfer. So the first one that we always talk about is convection. So that's described as the transfer of heat by movement of air. So you can imagine it's like wind, depending if you are in the Sahara or in the Arctic, the wind feels differently, and that can be compared to actually the convective heat transfer that you see in an incubator. The second one is called radiation. So that means it's the transfer of heat from a warmer object to a cooler one without the physical contact. So that's what you probably have experienced by the sunshine, so it feels warm, but you don't have physical contact. And that's actually what we use in an open warmer. So you have the radiant heater that provides radiation to the baby. Then we have evaporation, which means, or which occurs when moist surfaces are exposed to air and heat is lost when the surface dries. And that's actually what happens, especially for premature babies. They lose heat by evaporation, and that's caused by transepidermal water loss. That's why in many incubators you use humidity, and we will come to that later as well. And last but not least, we have conduction. That means it's the transfer of heat from an object with direct contact. So, for example, you have a car where you have heated seats, or if you're sitting on a cold stone, that's actually how it feels. And if you look at our warming therapy devices, this can be achieved, for example, with a heated mattress. So in the following, I would like to explain you in more detail how a warming therapy device can support you with this. So we take the IncuWarmer Babyleo here as an example, since it combines the radiant warmer and an incubator, as you can see here on the picture. As an example, to make it more transparent, you see a labor and delivery situation where the nurses and doctors take care of the baby in open care. So they stabilize the baby in the first minutes of life, even maybe the first hour, and try to stabilize the baby so that the baby is ready for the transfer to the NICU. When they feel the baby is stable and they've done all their care procedures, they close the hood and basically let the incubator warm up so that the device and the baby are both ready to be transferred to the NICU. So it's one device usable in different situations. So it's important that the neonate receives warmth in all those situations, either by the dual radiant warmer in open care or by the convective heat in closed care. And what I just also mentioned, the heated mattress can be also used to support the heat or the heat transfer in both situations. And that will have, that's definitely an advantage in different situations, and we will come to that also during this presentation. To underline that all those 3 heat sources that you can see here are synchronized to provide the optimal thermal environment for the patient. For the radiant warmer, it's important to have a strong radiant warmer that provides an even heat distribution all over the mattress. You don't want to have hot spots or cold spots where the baby lies on the mattress. But have you ever thought about what's impact it can have if you tilt the mattress for an open warmer? And that's actually where you, with older devices, where you can create actually cold and hot spots. With the radiant warmer of the Babyleo, we have this so-called dual radiant warmer, which means that it automatically adapts for the heat output when the mattress is tilted, so that we can ensure that the baby receives an even heat distribution. I already mentioned that the heatless mattress in Babyleo is new. and I would like to explain you with some background what the advantages are. So why is it so beneficial? And for that, let's have a look at the data. So there are some older studies, and they have shown, or they looked at what happens if you use a heated mattress for babies. Here they used an open care device, and they had one control group where they didn't use a mattress and a group where they used a heated mattress. And what you can see here actually on the slide is that when they used the heated mattress, the radiant warmer did not have to use that much power. If we look at the second graph, they looked at the relationship between the radiant heater power and the insensible water loss. And what you can see here is the higher the radiant power, the higher the insensible water loss. And if you bring these two together, you can actually say if you use conductive heat, like a heated mattress, you can reduce the radiant heat of the open care device, and by that also reduce the insensible water loss, which is especially important for premature babies. So with Babyleo, we offer this optional heated mattress, so to ensure a faster warm-up time for the patient. And by that, we can reduce the radiant heater, and by that, reduce the insensible water loss. What's also important to note is that you can actually take X-rays through this mattress. And yeah, overall, we can help here to support the overall thermal comfort of the baby. If you have an IncuWarmer, it's especially important to look at the transition time. So that means during the phase from opening to closing or the other way around. So in this phase is really crucial to keep the baby warm. That's why we actually developed in Babyleo a way to have the two modes active, which shortens ideally the warm-up time for either of the modes. So what does that mean? So if you use the device in open mode and then close it, we have the convective heater already preheated. So if you close the device, the convective heater is already on and can directly jump in and warm up the incubator. Also the other way around, if you are in the closed mode, so in the incubator mode, and then open the device to the radiant warmer operation, we have the radiant heater already in preheat, so it doesn't have to start from scratch. It's directly there and can start in. And that's especially important for the phase of the transition. Another positive side effect of keeping the radiant warmer active, even if you use the device in incubator mode, it actually warms the hood when the device is closed. And that can reduce the irradiative heat loss, but at the same time, if the hood is warmed, it can also reduce the rain out when you use a high humidity in the incubator. We call this clear view because you can have a clear view to the patient. And actually, this concept is not new. You might know it from also other generations of incubators where you have the so-called double wall concept. So basically 2 walls, and this should have the same effect. With Babyleo, we found a way actually to use the radiant warmer to get to the same effect. Why is humidity important? It's very well known from various studies that a high and uniform humidity inside the incubator can actually reduce the transepidermal water loss. So here you can see a graph from Hammerlund. It's from 1979, but it's still valid. And it basically shows that if you have a 26-weeker here in the example, that you can decrease the transepidermal water loss if you use a relative high humidity, for example, 80%, and you definitely decrease the transepidermal water loss. For full-term babies, it's not that crucial, as you can see here in the graph. What can we do in an incubator, and how is it addressed in Babyleo? Of course, you can manually adjust the humidity as for other incubators, but we also have the auto humidity mode, which means that the device automatically adjusts humidity based on the air temperature that was chosen. So the logic behind that is the smaller or the younger the premature baby is, the lower is their own heat production and the higher the air temperature is and the higher the humidity is. This is what you can actually see on the graph. This is the algorithm behind it. And it's, on the other hand, for the caregiver, nice because it's less work to manually adjust the humidity. Last but not least, I would like to briefly mention that we have also further advanced temperature management modes. That means, for example, thermomonitoring. Oliver brought it up at the beginning. Thermomonitoring means that you simultaneously monitor two temperatures, so the central and the peripheral temperature, so that you have an early indication how your baby is doing. Here are some examples. You see the central and the peripheral skin temperature. And if you monitor the two temperatures, you get an early indication, for example, if your baby is in cold stress or really going down into the path of hypothermia or hyperthermia. And you can also see if the baby gets fever or if the baby in general is still adapting to the environment and has thermoregulation problems. We also support 3 other modes, the warm-up mode that regulates the patient's temperature during the admission. We have the tolerate cooling mode. This is rather a support if you have to cool the baby, then you can do that also in combination with Babyleo. That means that the device tolerates cooling. And then we also have a weaning mode. So when the patient is stable enough to get out of the incubator and you can reduce the temperatures, this is an automatic mode that does the step down for you. Before we close this section on thermoregulation, I would also like to mention that it's not just only the incubator, but there are also environmental factors that can have an influence on the thermoregulation on the baby. So depending where your workplace is, your incubator is placed, you might have radiation from the windows and from the outside. You might have AC outlets that directly go down to the incubator or to the mother that is just doing kangaroo care. Then you can have external heat sources like lamps. Phototherapy lamps are also considered as a heat source. You can have CPAP and by that add additional humidity to the incubator. You can have some leakages through the grommets, which is normal because an incubator or an IncuWarmer is not a sealed environment, so there are some losses. And last but not least, if you open the door and it's cold outside, the cold air gets in and can have an effect as well, and an influence on the baby. So that was the part about thermoregulation, and now I would like to make the switch to the topic of developmental and family-centered care. So the expert Heidelise Alts once said, each infant has one brain and everything matters. That's a quite important statement that we also take into consideration. And we know that providing a nurturing environment improves actually the developmental delay and the cognitive impairment of the baby. If we look at the ideal place for the baby, it's obvious that the utero is the best place for the baby to grow and develop. This is where normally the brain develops and all senses also develops. So we talk about the tactile system, the vestibular system, the olfactory system, the gustatory system, the auditory system, and the visual system. All those senses develop normally in the uterus of the mother. If we also look at the normal brain development, we can see that in the last trimester, the brain is most active, so between the 24th and the 40th weeks. And we also see that the brain in that period rapidly grows in size and all the very important synaptic connections are made. Actually, also in that period, the brain weight increases by 400%. which is quite a lot. If the baby is born, also the brain develops continuously, brain cells grow at a tremendous rate in the first months of the baby's life. And depending on the stimuli that the baby receives, the different nerve pathways are built up. And the more connections are created among the brain cells, of course, the better. However, if we look at the at premature babies, it's a bit of a different picture, because they spend the first weeks and months at the NICU, and that's of course a great difference to the environment in utero. So all those different, sometimes also rather negative stimulation on the NICU can cause delay in development. So 50% of premature babies show abnormal brain development. And that, of course, can have an impact on the long-term outcome of the baby. But the good news is that there are definitely ways to improve that situation and to help the baby to develop in a better way. As I mentioned, all these senses develop in the last trimester, and if the baby is born prematurely, they develop intensively during the time on the NICU. And in the following, I would like to focus only of those three and see what we can do with the baby Leo to support that. So first, I would like to start with the tactile system. So if you look at NICU patients, they receive on average 200 disturbing procedures a day, which is quite a lot. And it can range from taking blood samples, intubation, replacement of the feeding tube, and so on. And an average says that 15 procedures are actually painful for the baby. And the target actually with the idea of developmental care is to reduce those negative stimuli or touches and promote positive touching. And the first thing which is positive or can be used as positive touch is kangaroo or so-called skin-to-skin care with the parents. Here you see a meta-analysis from 2016 that actually screened more than 1,000 studies and summarized results of 124 studies around the topic of kangaroo care. And what they found out is, by looking at all those studies, is that if you do kangaroo care, that there is a decreased risk of neonatal sepsis, hypothermia, hypoglycemia, and also by the end, at the end, hospital readmission. Also lower respiratory rates and pain measures were monitored. And at the end, it also lead up to a better head circumference growth. Also, researchers found out that there is a lower mortality if you do kangaroo care. So to summarize, they found out that there is no harm of doing kangaroo care, and that the authors strongly recommend kangaroo care as an intervention that should be implemented in the care of the baby. So if we want to do kangaroo care with baby Leo or in general, it's important to acknowledge that it's a very special moment also for the parents. They are maybe afraid, they are nervous to take out the baby out of the incubator, and therefore it's really important to give them a peace of mind and don't let them get confused by alarms of the medical devices on the NICU, like the incubator. It's also important at the same time to continue to monitor the patient, the temperature of the patient, and to ensure the microclimate of the incubator, that when the baby is coming back, that there is already an adequate microclimate. So with baby Leo, we can support you with that, with the so-called kangaroo mode. So we have pre-silenced alarm, we have the temperature monitoring, and the incubator automatically warms up or stays warm so that you can also put the baby back in time. And on the other way, it's also important from an ergonomical point of view to support this with appropriate height adjustment and also leg days. But how does that look like? So here you see some pictures how a design of a warming therapy device can actually support parents with kangaroo care, or just also with access to the baby to promote the positive touches. So we have for the baby Leo, we have the very low variable height adjustment. So when the mother is, for example, still in the wheelchair or has to lie in the bed after the C-section, you can bring down actually the baby Leo rather low so that the mother is able to get a look at the baby or even touch the baby. And yeah, the same applies also for kangaroo care. You can bring down the incubator rather low. It's not always about the positive touch, but it's also about reducing the negative touches. And especially within IncuWarmer, we have also here opportunities to improve that. So with the baby Leo, we have an integrated scale. That means you don't have to take out the baby to get the weight measured on an external cold scale. You can do this directly in the incubator without disturbing the baby that much. And what's also nice, of course, is that the nurses and doctors and also the parents can directly see the weight of the patient, because it's also stored directly on the screen. Also, what's important is if you imagine every stimuli can have a positive or negative impact, even if you do the tilt, the mattress tilt, you can do that in a very smooth and quiet way. And we actually do it with a baby Leo in with an electronic adjustment, which is very smooth and quiet for the baby. Last but not least, X-rays can be also a negative stimuli if you, for example, have to place the baby directly on the X-ray cassette. The X-ray cassette might be cold, which is also from a thermoregulation point of view not a great feeling. You can imagine if you are in your warm bed and then you have to get out and lie on the cold floor, that it's not really nice. And actually this unpleasant feeling sticks, let's say, or the brain remembers that unpleasant feeling. So with the X-ray cassette here, we have the opportunity to access the X-ray tray from the outside. We can do an X-ray without even touching the baby. So now we come to the auditory system, so basically the hearing. If you imagine the baby the fetus in utero, the baby hears low frequencies, not really high-pitched frequencies. It's very, very nice. On the other hand, if the baby is at the NICU, the sounds tend to be very aggressive. So you have high frequencies because of all the alarms that are ongoing. They can actually range between 60 to 90 decibels with some really high peaks. And it has been found out that depending on the intensity, on the frequency, on the periodicity or the duration, it can have actually very undesirable or harmful outcomes for the baby if the premature baby is exposed to this noise. What are the consequences from a clinical point of view? It was observed in several studies that the babies have apnea, they can have hypoxemia, also alterations in O2 saturations were observed, as well as an increase in O2 consumption, elevated heart rate, elevated respiratory rate. Again, and that causes again that the baby has to use its calories to balance that, and all those calories cannot be used for the growth. And from a long-term perspective, it was also observed that many premature babies were diagnosed with hearing impairment. So that's why the American Academy of Pediatrics actually gave out a recommendation, and it's rather a vision where NICUs should strive in the future. So they are actually ask for a reduction in noise level down to 45 decibels. And it's not just the incubator, but it's the overall noise in the NICU. So different devices, different behaviors can cause that noise level. They also suggest that the noise should be measured inside the NICU and also inside the incubator. It should be done continuously, and by that you can better find out how your NICU is working, and by that promote a better growth and outcome for the baby. Here's an example what an infant can hear in the incubator and how that can be compared to noises that we know. Just want to outline a few here. So at 60 decibels, which is more like a normal conversation, it can sound in an incubator like the phone is ringing. This is annoying, but not yet, let's say, dangerous. If you move down to 90 decibels, that's for us more like a pneumatic drill, for example. On the NICU, it can be a monitor alarm, and that is already at a noise level where patients or babies can experience hearing loss if this is consistently going on. At 120 decibels, that's actually if you put your music very loud in the car, for example. And in the incubator, it can be compared like if you are knocking on the incubator or placing something on the incubator very loudly. And if this is a really loud sound, it can cause pain, distress, and a risk of immediate hearing loss of the baby. So what can we do with baby Leo here? Overall, we paid attention that we have a quiet device handling with all the drawers, with opening and closing the hood. We also designed the device in a way that if you have a typical operation of the device has a decibel level of 40 decibels. And we have the smart alarms that I already mentioned, for example, in Kangaroo Care. But on the other hand, we also implemented sensors that actually can measure the noise level. The noise sensors are directly in the patient compartment close to the baby and really reflect what the baby is hearing. You can display them directly at the main screen so that everyone is aware of what's going on, but you can also see the trend here that you can see on the screen. And that also gives you the opportunity for awareness and also the opportunity to analyze what's going on, for example, during certain procedures that you are doing and what's going on the NICU. So for example, are there special times during the day where it's really loud? For example, if let's say the cleaning personnel is coming and vacuum cleaning the floor or so, and it's really loud. So now you can see those peaks and maybe also find a solution for it. On the other hand, there are also positive ways like music therapy. So the latest research shows positive effects of audio stimulation, for example, by playing music, either live or recorded, or also the voice of the mother and father. So the research has shown positive effects. So for example, a reduced heart rate, a deeper sleep, due to the resting, the babies can use their energy for growing. The O2 saturation was increased, and by that also in the end the weight gain. Another study that was published in 2019 looked at how music enhances the cognitive brain networks. They took several pictures of the brain. They had a control group and with music and without music, and they also found out that there was a better growth of all the of the brain if you use positive music. How we can support that, of course, it's the best if the parents are right next to the babies. We know that the direct contact with the parents is the best. However, it's not always possible. and it's not always possible to have a music therapist at the NICU. So we integrated into the Babyleo a safe way to play audio files from an MP3 player or your smartphone. So there is a little loudspeaker in the device, which was designed in a safe way, where you can actually attach your smartphone or MP3 player and play either music or the voice of the parents. And what's also important is that the volume is limited to 55 decibels to make sure that it still remains a positive stimulation for the baby and not a negative one, as we just described. Now we come to the visual system. So if you imagine the womb of the mother, you have very low light and sound. It's very dense, especially also at night. So the babies already get used to the circadian rhythm of the mother, and so that's usually what we have naturally, the 24-hour rhythm, like a day-night rhythm. But after birth, if the baby is in the NICU, you do not really have those planned cycles. You have either really bright light or continued darkness. So it's a very unstructured way in many NICUs, and that also has an impact on the baby. So there was also here a meta-analysis done in 2016, and they looked how a cycled light at the intensive care unit can have an impact for the preterm and low birth weight infants. And they actually compared the cycled light versus continuous bright light and versus dimmed light or near darkness. And what they actually found out is that it's favorable to use cycled light, as you can see here on the studies. So what can we do here, or what does also the American Academy of Pediatrics recommend? So they, based on all those studies, they also recommend to use cycled light between 10 and 600 lux. And each patient bed should be equipped with spotlights for this selective lighting. So what can an incubator do in this case? For Babyleo, we have these so-called hood covers that you can see here also on the picture. So even if it's not possible to reduce the light in the NICU, you can reduce the light for this one specific patient, and also use phototherapy at the same time. Furthermore, there are several ways of light at the Babyleo. We have the working light and the night light that can be dimmed and has different intensities. Also, optionally, you can attach an examination light like the Variolux. And last but not least, as you also can see on the picture, we integrated the so-called mood light for different colors, so that you can also, for example, switch this on during the nighttime and don't have to light up the room completely in order to look for the incubator. Like the noise monitoring, we also included in the Babyleo light monitoring. It works the same way. It's also displayed on the main screen, but also you can see here the trend. It shows you where you have very bright light at the NICU or where it's dimmed, and you can then adapt the practice to the needs of the baby. So to conclude, it's important that the overall neonatal workplace should support a day and night rhythm. So it's not only the incubator. That's why I'd like to, or I put here this picture. So you can see that there are monitors, there's maybe a ventilator, and it's beneficial to use during that day and night rhythm to also make use of this different screen setups, so that you have that you switch it to the night mode, for example. Next to developmental care, family integrated care is becoming a more and more important topic. And if you look also here at the research, it has been shown that if you find a way to integrate the family very well, that it can actually reduce the mortality rate of the infant. it increases the bonding, and by that also increases the parents' confidence to take care of the baby, which makes it also easier for them if they leave the hospital to take care of the baby at home. So the latest NICU designs actually include a way to integrate families better than before. And yeah, let's have a look at some pictures here. So here you can see a picture from a hospital in Germany, from Passau. And yeah, of course, this is a very luxury situation that you have one room where you have the baby Leo with the premature baby, and actually right next to it, the bed for the mother, so that they can stay together in one room and be close to each other. How did we address family integrated care with our devices? So what we always try to do is that we pay attention to a family-friendly design of the devices. So many parents feel intimidated by all the medical devices in the NICU. It's overwhelming for them. So what we at least try to do is that they do not feel that intimidated by the device. So for example, with the baby Leo here, we have the so-called family view that you can switch on when the parents are there. Parents can actually kind of customize the screen. They can add an icon, as you can see here, the butterfly. The name is displayed, the weight, which is an important indicator for parents, and they only see the most important information and don't get confused by any unnecessary information. Family integrated care also means that we create a very, a pleasant or more cozy and more comfortable atmosphere for the parents, so that they can take care of their baby in a relaxed way. So also light plays a big role, and you can see here a picture how this can be achieved, for example, by also using the mood light of the baby Leo. Actually, we also heard from some hospitals that they use this mood light to communicate with the parents, or that the parents have the feeling that they can choose a color and with a certain meaning, and be more involved in the care process of the baby by that. By not looking at the device, but rather looking at how parents feel and what kind of information parents need in the first days and weeks, we created the webpage so-called Baby First, where we have a section just for parents and try to give them as much information as they need to be able to cope with that situation and have information. So this is a website that can be accessed by parents for more information, but at the same time, there's also a section for caregivers where you find a lot of content, partly of what I also presented today. If you want to find out more about developmental care, of course, we also have other topics there, like thermoregulation, jaundice management, and so on. So please feel free to browse there. And last but not least, if you want to promote developmental care at your NICU, we have this poster, for example, with 10 tips how to promote developmental care that can be easily displayed at the NICU to remind everyone of just simple things, how to improve the outcome of the baby. By that, I'm already at the end. You can see here the sources that I used for this webinar. And by that, we are at the last point, your questions and answers. As Margarita said, please feel free to use the chat box, the questions box, to put in your questions.
So thank you very much, Inken and Oliver, for your great presentation. I think it was very insightful, and it gave some ideas on how we can optimize the thermoregulation and developmental care protocols in the NICUs. Let's, in the meantime, so now we're open to your questions, and So one of the questions that just came in is, are we allowed to use part of your notes for training? So we will be sharing the recording of the webinar with all of you, and we will upload the webinar on YouTube, and we will share the webinar with all of you. And for those of you who are interested in the notes, I think we would be able to share via email. So we have your information, we would be able to share via the email. Also, a quick update, once we finish the webinar, there will be a short feedback form. It's an anonymous feedback form, which it would be great if you could provide us your feedback with regards to this webinar. There's one question, heated mattress, is it new? Inken, would you be able to comment on this?
Yeah, of course. So heated mattresses in general are not new. So there are some open warmers, like for example, also the BabyTherm 8010, where we have a heated gel mattress, because the concept has quite some benefits, as you have seen here in the webinar. But so far there aren't any incubators or IncuWarmers or hybrids that have a heated mattress. Babyleo is the first one that has it. And I hope I could show you the advantages that it can have, especially during the time of transition.
Thank you very much, Inken. Are there any further questions with regards to the content of the webinar or any other questions? So far, we haven't received many. So once again, once you log out from the webinar, there will be a window prompt for you to leave your feedback. We would really appreciate if you could leave your feedback so that we can develop further training materials and further webinars that are customized for your requirements. If there are no more questions, I would like to thank you, Inken and Oliver, for this great presentation. And I would like to thank all of the participants who stayed with us for the duration of the webinar. And I would like to wish you a great day. And yeah, we will be sharing the materials after the presentation. Thank you and have a great day.
Thank you. Bye-bye.
Thank you. Bye-bye.